Hello, my name is Tina Cominsky. I am a nursing student at South Alabama RN program. I'm recording my medication administration video. This is my patient, Jaguar J. Jones. He needs to get Novenar insulin, 10 units, 30 minutes before meals. I'm going to compare the orders with the MAR. Jaguar J. Jones. His date of birth is 8/25/1963. 8/25/1963. His MR number is 416352. 416352. I see he's allergic to penicillin. I'm going to perform hand hygiene. I'm going to go into the bedroom, shut the door, so that I will not have any phone calls. I will not be talking to anybody. I will limit my distractions unless it's an emergency. Again, I'm going to double check James J. Jaguar. I am going to get his insulin. I'm going to double check with the MAR. Novenar, 10 units sub-Q, 30 minutes before meals. Novenar insulin. The expiration date is 12/1/2025. There's the Novenar. And the expiration date. Here is my syringe. Okay, I'm going to open my syringe. Careful not to touch too much of the needle. Throw that away. I'm going to inject air into my syringe. Since I want to drop 10 mL of insulin, I'm going to put 10 mL of water or air. I'm going to clean my insulin with an alcohol swab in a circular motion. Again, I'm going to double check with the MAR that it's Novenar regular insulin, and then this is not expired 12/1/2025. It's 10 units sub-Q, 30 minutes before meals. Okay, so I'm going to uncap my needle. I'm going to pick up the syringe or the vial. I'm going to inject my 10 units of air into my vial. And I'm then going to pull up the 10 units of insulin. Careful that we don't have any air. Not have it. I'll hit it just to make sure. Okay. We do not have any air. I'm going to float the lid back on. I'm going to make a label. What am I making? I'm going to make a label. It's going to have its name on it, the medicine, the dosage, and where it's going. I'm going to set that on my mark. I'm going to take the medicine, my vial, again, it's Novenar, 10 units sub-Q, 30 minutes before meals. Before I do that, I'm going to do an ACA check. So I'm going to go in. I'm going to go into the room and do an ACA check. Once I got all my stuff, all my supplies together, I'm going to clean the site. Throw that away. Mr. Jones, I'm going to check your blood sugar because you are due insulin 30 minutes before meals and it's almost lunchtime. It's 11:30. So I'm good. Is it all right if I do an Accu check? Okay. So I'm going to get the Accu check. Your Accu check is 120 is very good. So I have your insulin here. We will get it because your lunch will be coming very shortly. I'm going to put the head of the bed up. Put the side rail down. I'm going to reposition you. I'm going to give you your hep or your insulin in your belly, being careful to avoid 2 inches around the belly button. I am going to not go past the pubic bone or the iliac spine. I'm going to compare the name. Your allergies is penicillin. Do you have any other allergies? Your name is Jaguar J. Jones. Jaguar J. Jones. Your MR number is 4176352. 4176352. Again, you're getting your insulin. I'm going to clean the site. I'm going to put my goggles on. I'm going to re-clean the site. Take the cap off. I'm going to squeeze the site, and it's going to be a 90-degree angle. I'm going to inject it slowly. How did that feel? I'm going to sit you back up. Your lunch will be coming soon. I'm going to put the side rail up, put the bed back down. How are you feeling? I'm going to observe to see if he has any reaction to the medicine. I'm going to gather up all my supplies. And I'm going to go and document. And I will be back in 10 minutes with your lunch because I just heard the trays. So once I'll check on you again, but I need to tell you that you have to eat because I just gave you your insulin. Your Accu check was good, but you still need to eat. So I will be back. I'm going to take off my gloves, skin, throw them away in the garbage. For hand hygiene again, I'm going to take my stuff with me, and I'm going to go chart. I've given Mr. Jones 10 mL of non-LNR insulin, sub-Q. He tolerated it well. I'm going to go back in, take his lunch. There you go, Mr. Jones. I hope you're hungry. Do you need any help? No? Okay, I will be back to check on you before the end of my shift. Hope you have a good day. Bye.